about Breathe. So we are a large multidisciplinary group of faculty, students, staff. We're all about clean air, clean breathing, clean living, and healthy environments. And you can see there that we do a variety of things. We do research, of course. We do a lot of community outreach. We work with communities and have for 25 years, primarily helping them with smoke-free ordinance campaigns. That's what we're most known for. In the last 10 years, we've been doing a lot of radon work as well. That's taken on an interesting twist. We also do a tobacco treatment specialist training program, which is online. You can do it in your PJs at 3 in the morning. It's the only accredited tobacco treatment specialist training program in the world, believe it or not. And it's online, totally online. It's accredited, and it costs $800. And that may sound like a lot of money, but compared to the other ones in the world, that's the cheapest, the least expensive version, and we're getting a lot of interest in that program. So I just want to mention that. I'm also the Deputy Director of the UK Center for Appalachian Research and Environmental Sciences, that is a mouthful, but our job there is really to provide an infrastructure for faculty and community members to work together to solve environmental health problems, primarily in eastern Kentucky. So I just want to give a little background first. I won't spend much time here because most of you, I'm sure, know about lung cancer, know that it's really totally preventable. Of any of the cancers, I wouldn't want to get it because most people who get lung cancer actually die within about 12 to 18 months, although that's changing because of the immunotherapy and kind of drug development discovery, which is exciting. But it does have, it's the most commonly diagnosed, but it's the one that kills people most quickly. The reason it's preventable is because it's primarily exposure to tobacco smoke and radon. And you can't say that about many cancers, you know, and so if we reduce smoking and secondhand smoke exposure and exposure to radon, we probably wouldn't have lung cancer. And the interesting thing, and this is what caught my eye about 10 years ago, when I looked at the data and I realized that there's this synergistic risk between tobacco and radon. So most of the radon-induced lung cancers are in people who are also exposed to tobacco smoke. So that's an important thing to keep in mind as I move forward here. Okay, so just a little physiology going on here, just to let you know that the radon gas actually, when you inhale it, alpha particles are emitted, and then there are decay. Well, so radon is tough. If you look, and I didn't do well in chemistry, that's my disclosure, but if you look at the table of elements, radon's on there, but the weird thing about radon is it decays. And it decays into lead and polonium, and we think, or we know that it causes significant DNA damage, and it puts people at risk of cancer, primarily lung cancer. And I put this on here because, and I may have said this when I presented to you before, but I would love sometime before I retire or die, whichever comes first, to figure out how to find a biomarker for radon, because we don't have one, but we know that it does decay when it gets in the body. It's probably sitting in, you know, somewhere where lead, which is heavy, can sit. It's probably in your bones, or it's probably in your, it may be in your, whatchamacallit, this thing. I can't get the word. Anyway, so there's a lot we don't know about radon is my main point. Okay, so what I'm going to talk to you today about is some maps that we've developed, but we've also looked at some of the health impacts, and we've looked at the economic impact of these maps, these novel geologic maps. And I had a really wonderful opportunity that just kind of fell in our lap. And one of the things as students that you guys and faculty, one of the things that makes us successful is to look for partnerships. And when you do good work, sometimes people come after you and ask you to do things. Also, one of my other little gems is always keep your options open and look for opportunities. Take risks. And so I'm going to show you some of that. So up in the left-hand side, the Environmental Protection Agency has a map of radon, and they have it for every state in the nation. And it looks like that, and there's 3 levels, and they talk about zone 1, zone 2, zone 3. And so this is Kentucky on EPA, and you can see when you pull out Logan County, for example, it looks like there's 1 level of radon in that county. Doesn't give you much information, really. So we had the great fortune, again, risk, got a call from the Kentucky Geological Survey, and they said, hey, you're doing radon, you know where that comes from. It comes from rock and soil, and we know about rock and soil. We don't necessarily know about the health impacts, but we know about rock and soil. Will you work with us? And I went, well, sure, why not? Let's work together. So we took nearly 70,000 radon, or 60,000 radon values that we had from the last 25 years, and we mapped them on top of the soil and rock map that we have for Kentucky. And we came up with that thing. And that looks a lot different, right, than the EPA map. A lot different. So Logan County on EPA looks like radon's the same, but Logan County on our novel map is like, whoa, there's a lot of variability in that county. What's up there? So that intrigued us. So we, like I said, we got together with Kentucky Geological Survey. We used de-identified observed radon values from 2 major radon testing companies from 1985 to 2016. So it is proprietary data. It's nothing that you can just find out there on the web. We actually worked with AirCheck and Alpha Energy, and the only reason they would give us their data is because we work with them, and we buy a lot of test kits from them for our research, and so that, and they primarily serve Kentucky. One of the limitations, of course, is that you can go to Lowe's or Home Depot and buy a radon test kit, and if it's not made by Alpha Energy or AirCheck, it won't be in our data set. So keep that in mind, right? There's always limitations. But we do have over 60,000. These maps I'm going to show you, and that we tested the health and economic impact, were based on 60,000 radon values. We currently have 71,000 radon values because every year we get more data. But what I'm going to present to you is based on 60,000. We have their latitude, longitude, and we created these county level maps. And then we created infographics, working with our colleagues in communication and others to figure out how the heck to talk about this data with the public. And talk too about simplifying this synergistic risk message so people get it. And I'm not quite sure we're there yet, but we're testing that. And the whole point is to encourage people to take action. We want them to test their home. We want them to fix their home. And so we posted those, and they're still up on our website, breathe.uky.edu. Go to Radon, go to county level maps, and they're there. They're also at the interactive map on the KGS site. So you can go to the KGS site, and it's really cool because you can hover over a county and see all the data right there. KGS has put the means and the medians and the ranges and everything, and it's really, really cool. So I wouldn't go to our website. If you want to see the data, I'd go to their website. So I just brought this to show you all those test kits. You can see that in that central region of the EPA map, remember the EPA was that red going down the middle? You can see most of the testing has been done in that region. But you can see there's some counties, like look up here. I think this is Lewis, maybe. And that's 25 years of data. These blue are data points. So how many observed radon test kits or observed radon values do we have? So you can see kind of the variation in the 60,000 data points that we have. So this is an example of an infographic. It's a front and a back. These are all on our website. This is Warren County because Bowling Green sits right in that red, pretty red. And so red is most danger. So what we did was we worked with the communication folks and the little literature there is out there on risk communication with radon. And we learned that people don't necessarily understand the word risk, and they certainly don't understand the numbers, the picocuries per liter. What the heck, right? I mean, we as academics can grasp that, but most people don't get it. So we decided to have our These colors represent different ranges of picocuries per liter. But the public knows that red is the most danger. And notice we picked blue as least danger because the idea is that really everyone needs to test, whether you live in a blue area or not. But the other point here is look at all the variability. Just in Warren County, there's blue and green up in the northern part of the county. There's red coming down. But if I showed you this and you really open it, look, there's a little red here. There's some red actually in here. So right here there's red. You know, so the whole point of this is to say everyone should test. And that's the test your home, know your level. You're going to see that twice on the infographic on the front and the back. Lots of white space. That's what our communications people said. And then we came up with this, which is still not right, but it's the best we could do at the time. Breathing radon is dangerous, but it's even more harmful when you also breathe tobacco smoke. We have since added breathing radon is dangerous for everyone. We got that feedback. Anyway, but it's even more harmful when you breathe tobacco smoke. So this is what we tested, okay? This infographic had been up on our website, and we basically tested before and after it went on the website. But we also did some training, and this is very targeted training with these maps. We picked the top 15 counties, top lung cancer counties in Kentucky, and we reached to them specifically and said, would you learn about these maps? Will you take these maps and share it with your public? We'll give you some free test kits. Will you train people, give out free test kits, and see if you can get more people to test? So that was the first part of this. This is more the health impact part of my title here. So the workshop training, and let me just go back here. So free online radon workshops. So we started first by doing face-to-face, knowing that people wouldn't come, and they didn't. So we did a couple face-to-face, then we put it online, and people really, you know, came then and got involved. But again, just 15 counties, and we reached mostly to health departments, cooperative extensions, cancer coalitions, you know, not necessarily health professionals, but public health practitioners, I guess I would call them. A lot of environmentalists, too. And so these are the kind of content of the workshop. The workshops were very quick, like 30 to 40 minutes, which is still long for people. But most of the time we did it over lunch. People could, you know, get to their computer, eat their lunch, and watch and listen. So these are the things we talked about with them. We asked them to spread the word, and we gave them stuff. So we gave them their map. We gave them the link to their map for their county. We gave them free test kits. We asked them to test. We asked them to talk to their community about testing, give out the test kits, share the resources. We had this training bag. We bought these bags and just shoved a bunch of stuff, and I'll show you in a minute what was in there. And then follow up with their community, try to get them to test, talk to the media, and write a newspaper article. So that was the ask of all these people, okay? What was in the bag? We used AirCheck for this particular project, this test kit over here, Hum Radon test kit. We gave them their map, their infographic. We gave them a tumbler, a stress house, and a pen. So just some stuff, right, to make them, like, you know, to kind of brand the program, if nothing else. We gave them instructions on how to deploy test kits and how to tell people to deploy test kits. We gave them a PowerPoint. So if they would go to like a lunch and learn, or they could get on an agenda in their health department or anywhere, library, just go tell whoever you can tell. So we tried to make it easy for them. So basically, we had about 50 or 60, I think it was 60 people, something like that, do the training. So not a lot of people, but over 15 counties. Nearly half of them were health departments. About a third of them, almost 3 in 10, worked in a county extension office. They were very interested, actually. County Extension was really interested in this. About 2/3 of them took part online. So we deployed, or we gave out almost 1,000 test kits, and about 12% of them were deployed. So maybe that doesn't seem like very much, but that's about right, actually. I mean, you have to give out a lot of test kits for people to actually do them, to actually deploy them. And we had about over 1,300 website hits during this time to the infographics. So we did some pre-post survey just with the 60 or so. So this, I just wanted to share this with you, that it didn't matter whether they were health department people or whether they were online or in person in terms of whether they distributed test kits. It didn't matter. So that's good. You don't need to get people in a room. Online's fine. But they did say that time was an issue, obviously. They also perceived that residents really weren't interested, didn't really care about radon. And some of them just went on behalf of somebody else. And I think a supervisor probably said, you need to go to this thing, you know, and they didn't really care. So we did look at synergistic risk to see if there was any increase pre to post, and there, you know, at least that the p-value is not significant, but, you know, this is a small sample, and, you know, basically we were hoping they would at least see that radon and tobacco smoke were associated. So it was in the right direction, but anyway, what I really want to get to is this, because this is the coolest thing, I think. So we had an opportunity, because we had done these cool maps and these cool infographics, we didn't think anybody was watching, right? Well, apparently, the U.S. Geological Survey was watching. Plus, they got a call from Congress and said, we're going to cut your budget if you don't show us that you have value. So they were like, ah! That's when people do stuff, right? So Carl Shapiro, Frank Casey, and Scott Chiavacci basically reached, Carl is the one, reached to me, and well, actually reached through William Andrews is here at UK, you can see. So, and said, hey, we heard you have these maps, and we've seen them on your website. Can we see if they have any value, some economic value? Because Scott is an economist. And they called me, and I went, okay, sure, you know, let's talk. And it took not too many months. We met like every week, and we had to get a bunch of data, though, together to give to the economist. And we were given the charge of quantifying the value of these maps. And so I thought, this will be really cool, but we probably won't find anything. But interestingly, we used this value of information technique, which don't ask me to explain because I'm not an economist. But this is the value of collaboration. You work with people that are experts, and I'm an expert in my own way, but he is an expert in his own way. So they estimated the economic impacts associated with lung cancer for this scenario with and without access to the maps, okay? So basically, before the maps were posted on the website, you know, before we did any of that training, and then we had a little lag period, and then after, right? And so they did this 9-step process. I'm going to walk you through it without boring you too much, but I just want you to get the idea of what you have to do to quantify the value of a public health intervention, because that's what this is. So the monetary value in lives saved through use of geological maps to convey radon potential. So step one, and you'll follow me here, but near the end you're going to go, what did they do? Because that's what I said too. So first we said, okay, was there a change in the number of households that tested for radon before and after the maps, right? So the before testing rate is up there, the after testing rate was up there. We looked at the census data to know how many households there are in Kentucky. We also looked at census data to figure out the average number of persons per household. And then they did the math, pre-maps, post-maps, okay? And the whole point was how many additional people tested for radon pre and post. And we came up with that number. Additional people testing per radon per year was, anyway, so it's 74. The difference, right? So additional people tested, they took the 807 minus the 733 and came up with 74 people per month times 12 to figure out what per year. Makes sense, right? So we have that number, 891. I'm not going to test you on this, but I think you just get the feel here. So the second step in this 9-step process, we're to say, look at the change in the number of tested households with radon levels equal to or greater than 4 picocuries per liter before and after. So again, all of this is estimating. That's what economists do. They kind of forecast. They kind of estimate what might happen or what's our best guess. So we took the data we had, the 60,000 radon values, and we simply, found out what percent were high. So 42%, this is a real number of the 60, we didn't make that up, 42% of the households that tested over that 25-year period were high for radon, were either equal to or greater than 4. And that may surprise you. It kind of surprised me. That was pretty high. That's 4 in 10. Maybe not, because we're a high radon.
Which counties were these?
The whole state.
Oh, this was the whole state?
Yeah. The whole. Remember that map that had all those data points?
It wasn't just
the 15 counties that we trained in.
This was the whole state.
This is the whole state of Kentucky, the 60,000 radon values. So the estimate then was additional tested households as a result of the maps. So that 891 number from the last slide multiplied by 0.42, and they came up with 374.6 with high radon levels every year. Got it? Are you following me still? Okay. So let's go to step 3. So then the question was the change in the number of households with high radon that mitigated before and after. Now, this is where it's estimated because we don't know. We have no data to show that. So based on all the research we've done, and I presented our FRESH project before, but we've done probably 5 different radon intervention studies. We've been doing this for the last 5 years. And so we know, based on our research, the percent of people who mitigate once they have high radon. So we use the 17 to 22% or 20%, which is sad, really. So what that says is 20% of the people in Kentucky, we estimate, mitigate. 20% of the people with high radon actually fix.
You want questions now, or you want us to hold them? Okay. So basically, yeah, but 4 is a pretty low number because those of us who kind of consult with people, if it's 4 to 10, a lot of times we'll say, well, how much time do you spend in your basement or where there's high radon? But around this region here, we'll find levels that'll be between 10 and 20.
Yes.
And then we start saying, if this was my home,
Yeah.
I would mitigate. Did you break it out by higher levels than 4? Because I bet that percentage would go up if you did any sort
Well,
of
based on our research, limitation here, that's the best we can do.
Okay.
And actually I presented this nationally, and people said, yeah, that's about right, unless you have policy change that requires people, when they buy a house, to fix it. So that doesn't, we would get different. We're trying to be as conservative as we can, basically, because we're publishing this, and people are going to throw darts at us. But anyway, so we used the 20%. So we took the 374.6 times 20%, and we estimated about 75 mitigations per year. Okay? All right, so let's keep going. You with me? You're still with me, right? So number 4, we took, now this is interesting. So then we have to control, well, I'm using that loosely, but consider smoking. You got to, right? In terms of lung cancer, because that's the primary risk factor for lung cancer. So the number of smokers who would avoid lung cancer from radon exposure before and after use of the MAPS, okay? So we know from the BRFSS that about 25% of Kentucky's population during that time, and this is an estimate, because sometimes it was higher, sometimes it was lower, but about 25% of people over 18 smoke. So if radon exposure in a smoker's home is greater than 4, the likelihood of developing cancer is, okay, that 0.062, and I should have put the citation on here, but we do know that, and we didn't just make that up, we looked at the risk per 1,000 in radon-induced lung cancer. So the epidemiology says that if you are a smoker, you are about 62 per 1,000 ever smokers will get radon-induced lung cancer. So that's why we use the 0.062. We multiplied the 75 people who mitigated or estimated to mitigate times the percent who smoke times the risk of radon-induced lung cancer in that population, and we came up with 1.138 smokers per year who would avoid lung cancer. And I went, well, this isn't impressive, okay? But stick with me here, okay? So that's what we found. So 5, we said, how about the non-smokers? because you got to consider both, right? So the non-smokers who'd avoid lung cancer from radon exposure before and after the MAPS. So 75.5 don't smoke, so the flip of the 25% don't smoke. And again, we use the 0.007 because that's the estimated odds ratio for radon-induced lung cancer in non-smokers. So it's 7 per 1,000 non-smokers will get radon-induced lung cancer, and that's based on epidemiology that's been done in Iowa and other places, and the Beer report and everything. So 75 people mitigate per year times 0.755. That came from the last slide, 0.077. So, or I'm sorry, that's not, the 0.755 is the percent who don't smoke, right? Came up with less than 1 non-smoker per year who would avoid lung cancer as a result of the MAPS. Okay, 6. So just simply add those. The people, smokers and non-smokers who would avoid lung cancer. So we just add them up and come up with 1.5 person. Now, this is the fun part, translated into money. So we know based on this citation in here what the potential lives lost to lung cancer. So we know the value of 1 life. This freaked me out, actually. I knew it, but I didn't know it until I saw it. That $3.5 million is the value of 1 person, 1 life lost to lung cancer. So when you multiply step 8, benefits, the 1.534 people times $3 million, whoa, $4.1 million saved per year. Like, whoa, really? Really? That's a lot of money. Okay, but we're not over yet. So 9. So this is where it gets kind of like, whoa, I'm not an economist, but I try to play one on TV. But so annual monetary benefits after the MAPS. So we had to make an estimate of the time from radon exposure to diagnosis. This was hard. I called everybody I knew. I talked to the Kentucky Cancer Registry. I looked at every paper I could possibly get my grimy hands on. Like, how many years does it take once you're exposed to radon to really get lung cancer? So we came up with a range. Believe it or not, some citations say 5 to 15 years, right? So that was our estimate. And we also had to figure out what percent of the, we had to figure out survival, like how long do people live, right? So we also estimated that about 70% of patients live only 2 years post-diagnosis. So we used 2 years to calculate the value of a life lost. I mean, we had to somehow account for both of those variables. So we have a range, you know, we estimate that if you buy the 5 years of exposure from radon to diagnosis, then we're going to save about $3.8 million a year in healthcare costs. If you're leaning on the side of 15 years because you don't believe it, you know, somewhere between 5 and 15 years. So the range is somewhere between $2.3 million and $3.8 million a year in healthcare cost savings. So hopefully I didn't lose you, because I'm about ready to so hopefully you got an idea of how this would work if you were trying to figure out the value of a public health intervention like a MAP. So basically we would estimate that we did increase radon testing and mitigation, or we would estimate that we did increase it. We did show fewer cases and years of potential life lost, and we could save somewhere between $2.4 and $3.8 million per year. And this made USGS really happy because they could show actually the work that they do might save a few dollars. And I don't think they've cut their budget yet. So that's a happy thing. I just want to put in one little advertisement that we do have free CE for radon, and any of you can take it if you need continuing education. It's up online, it's easy, it's free, and you can learn a lot. Yeah, so that's it.